My name is Rachel Moore. I'm 44 years old and I was born and raised in Chicago. I'm a registered nurse with a background in pediatric intensive care. I love taking care of children. I love singing, public speaking, teaching and acting. Well, I had had the LVAD for approximately 9 months. And what they had said was that after they first put it in, it looked as if that I might be able to recover and have the LVAD removed in 90 days. And that was not the case. My heart was not recovering the way they had hoped. And I had been exercising on the treadmill, just doing what they had said, but it just wasn't recovering the way they had wanted it to. So this particular visit, the doctor said, it's not recovering the way we want to, and he said, the next step, I believe, is a heart transplant. And he said that because I was a high risk, very high risk candidate, he thought that I should come down here to be evaluated by Dr. J. David Vega.
Well, Rachel is a special lady. She is really an example of a patient who has just an amazing, zest for life and has really struggled to get her life back. And she really is the reason, and patients like her are the reason that programs like us exist. She came to us originally from Chicago after having a left ventricular assist device implanted there. She had a better family structure support in Atlanta, so her surgeons there referred her to our program. And if you can imagine, she's coming to visit our program with an artificial heart device and seeing a new set of doctors and discussing whether transplant is an option or is not an option. So you can imagine how terrified she was. She came to us with her mother, and I remember seeing her and talking to her a lot about what our options were, if transplant was going to be an option, and just telling her the first thing we're going to do is get to know her very well. She really is a vibrant person and has really done very well. Patients like her are the reason why we do what we do.
I had the heart transplant on January 15th, 2009, and I was on the waiting list for 14 months. Yeah, 14 months, and it was actually 2 years and 1 week since I had the LVAD put in till I had my heart transplant. When we first got here, literally when I first got here, we had to go to the hospital that day, and they were all welcoming. It's like, bring her in, from the first day that we got here, and people have cared for us and loved us, and even, people that we didn't even know. They're just like they welcomed us like we were family. So yeah, I would definitely recommend Emory. I'm looking forward to driving. I've always been a get in the car and go and get on the highway and just go. I'm looking forward to driving. I'm looking forward to traveling. I'm looking forward to being able at some point to go back to work. I'm looking forward to going to school, whatever life brings, That's what because I have this second chance to live, and that's what I want to do. I want to live. So I'm looking forward to that. Of course, never in a million years will I be able to repay the donor family, how can you say thank you at their loss, But I have another chance at life, and never will I be able to repay them. The doctor said that I would feel so much better, after I had the transplant surgery. And at that time, I didn't know what better felt, because with the LVAD, I was feeling better than what I felt before, but I didn't even know what so much better was. And right now, I'm feeling better. I'm feeling really good, and that's the most unexpected thing, is that there was a family that I got a precious gift from them.